Hi sir, welcome to our channel.
Thank you, Ravi. Hello.
How are you, sir?
I'm fine.
Sir, first of all, I am very thankful for you to join the Zoom meeting here regarding COVID and the COVID crisis. Uh, Please, I'm very thankful to you for this precious time giving, sir, because you are the very busiest person like in third wave. You are the main treaters for the COVID, pulmonologist. Okay, sir, how is going, sir?
Regarding cases or what?
Regarding this third wave cases.
Most
In your
most
hospital.
of the cases, what we see are generally mild cases. Like they generally come to OPD with fever, cough, and some running nose and sore throat. Most of these patients, generally we give only symptomatic treatment, and most of them resolve. But there are a few patients who are generally elderly, or patient who has got underlying heart problem or uncontrolled sugar levels, or patient who are on steroids. These patients land up having severe forms of COVID as well, despite having Omicron variant. So these patients, number is definitely less in comparison to the second wave. But still, we are seeing a few number of the patients who are getting admitted in the ICU and requiring oxygen or even ventilator. So especially people who are not vaccinated or people who have any underlying health issues which compromises their immunity, they are at a more high risk of landing up with severe pneumonia requiring oxygen and ventilator. But apart from that, most of the patients whom we see are generally doing well. They just come with OPD with a running nose or fever and some body ache, which generally respond within 2 to 3 days.
Okay, sir, I don't want to waste your valuable time, sir. Just one question, straight question I am asking. Why this variant is changing, sir, every year? First, we are seeing Delta COVID-19, and after the Delta variant, and recently Omicron, and yesterday suddenly from Wuhan it will came in a picture, that is pneumoco virus.
Okay,
Why
so
this
see,
changing?
any virus for that matter, any living being on this world, the primary motto is to reproduce and replicate.
Yeah.
So the same thing is even for virus. So virus wants to keep replicating. That means increase in number. So to increase in number, they need to undergo genetic alterations very frequently, which we call it as mutations. So these mutations are a way by which the virus make themselves capable of replicating. And so during these mutations, generally most of the mutations will be less lethal. They will not have much of problems, but like a few mutations like your Delta variant, where the mutation happened in such a way that the virus became more virulent. That means it is capable of causing severe forms of pneumonia in the patient who get these viruses. Similarly, in the Omicron variant, it became a variant of concern. As the WHO says, which is a variant of concern means it is capable of, these mutations are capable of making this virus behaving in totally a different way. So this Omicron variant, what happened was, it was very much transmissible. That means it was 4 times more transmissible than your Delta. That means if I get a Delta variant, if I transmit it to 4 people, if I get an Omicron variant, I can transmit it to 16 people. It is 4 times more transmissible. So these mutations will keep happening. It is not that once Omicron comes, the corona will die. No, it is not like that. These mutations will keep happening because the virus will always find a way to evade your immune system and vaccination so that the virus can survive and replicate. So this is a very natural process. This not only happens only with the COVID virus, it happens even with influenza virus and other viruses. But only those mutations which makes this virus behave in totally a different way, like making it more serious, making it capable of causing more serious infection, or making it capable of making your vaccination ineffective, or making capable of affecting a large number of population, thereby making your healthcare system collapse, they are referred to as the variant of concern. So in such
Okay.
variant of concern, we have this Delta variant and Omicron variant. For your another question, this NeoCov that has recently been released, actually
Yeah.
it does not belong to the same COVID virus. It is a part of the coronavirus family. So coronavirus is a group of virus. In that one we have is the SARS-CoV-2 virus. In addition to this, we also had a SARS-CoV-1 virus initially, which was the first SARS-CoV which was there in China. And in addition to this, we have something called as a MERS-CoV, which is the Middle East respiratory COVID virus. So this NeoCoV is found to belong to the member of your MERS-CoV, not your SARS-CoV. It is totally different from your SARS-CoV. And it has been found in South Africa, the bats were found to have this NeoCoV.
Okay.
And few people suggested that it has got some capabilities that it can enter into the human being also. But till now, we don't have a case of a human case of a NeoCoV. But experimental models have suggested that there could be a possibility. But however, other studies have also said that the receptor through which this virus enters into the human body and the bat are different. So that even though it can transmit amongst these bats, it cannot have a transmission into the human. So we don't know. These are very, very in the early stages. That is why WHO has clearly said that they are following up this NeoCoV, but till now we do not know whether it is capable of being transmitted in the human beings or not.
But in Wuhan, 1 in 3 or 1 in 3% is severely
no, that is because what they have said is it belongs to the family of this MERS-CoV, which I said to you before. This MERS-CoV has previously also caused Middle East respiratory COVID virus that occurred in the Middle East region. During that time, what they have observed is 1 out of the 3 patients had severe forms of pneumonia and they died. So since this variant also belongs to that family, so they are expecting that in case if this virus comes from bats to humans, there is a possibility that it is capable of causing a severe pneumonia. But till now, they have not proven that there is a transmission from the bats to humans. Until now, there are no documented cases of human to human transmission also of this NeoCoV virus. So it is very too early to say whether this will happen. What they have said is that we need to be cautious that in future there are chances that it may happen, but there is no guarantee that it will 100% happen.
Okay. Thank you, sir. And coming back to this Omicron, regarding Omicron, if any person is infected, all this whatever medicines in your experience, whatever medicines you used in COVID-19 and Delta variant, same whether you are using same medicines in this Omicron.
So most of the management of this third wave, that is the Omicron wave, is not much different from the Delta wave.
Okay.
In the OPD practice, the medication still remains only predominantly symptomatic treatment. Like for example, if you have a fever, you have to take paracetamol, you have to get yourself adequately hydrated. We give some medications for the suppressing the cough. But one medicine we have recently that has come into the market, that is the molnupiravir, which was not there during the second wave.
Yeah.
And the one treatment change that has happened in the Omicron variant is previously monoclonal antibodies were found to be very effective. But right now in the third wave, because of Omicron, they say that the monoclonal antibodies are less effective. But apart from that, the most of the treatment for those people who are admitted in the hospital still remains the same as per the Delta variant, and there is not much of a difference.
I think it is not affecting so much on lungs, mainly comparing to Delta variant.
Yeah, definitely this Omicron variant is not causing that much severe pneumonia as we saw in the Delta variant. And most of them causes only upper respiratory infection, like running nose, nose block, sore throat, some amount of body weakness and fever. But having said that, any patient who is unvaccinated or immunocompromised or they have underlying health related problems, we do see few patients developing the classical forms of pneumonia that we saw in the Delta variant. So we have to be very careful. We cannot take it lightly that it is just like a common cold.
Okay. Do you think, sir, it is not severity because of 50% vaccinated in Indian people? Because of this vaccination also, this is not effect on the lungs? Do you agree
So
with this one?
definitely because of vaccination, the severity of the infection has definitely come down. That is one of the reasons. But the
Okay.
second reason is this variant is not that severe as compared to the Delta variant. So in India, since vaccination has been very good, definitely we are seeing much less severe cases in comparison to the unvaccinated population in other parts of the world. So yes, vaccination plays a very important role in decreasing the severity of infection.
Sir, in your OP, have seen any children infected with this Omicron? Any severity is there in children? So, because why this question I am asking is so many parents are they are afraid because of third wave will come only for children. So, in your experience, this will happen? This happened.
Definitely, we are seeing quite a number of children getting infected with Omicron variant. But the good part is like most of these infections are mild. Like they don't land up requiring oxygen or ventilator or severe pneumonia in the lungs. So children are also affected, but severity is very less. And most of the infection in the children is also self-limited.
Okay. Sir, people with comorbidities like diabetes and heart infections, hypertension, like this, how they are getting this one Omicron? How they are recovering from this Omicron, sir? Is it how much percentage they are recovering? Otherwise, severity is there. They are admitting still.
So definitely these are called as the high risk population, and they are capable of moving from a mild infection to severe pneumonia requiring hospitalization. Even in our practice, only these are the people who finally land up in the ward admission or in the ICU admission requiring oxygen and ventilator.
Okay.
But this proportion of the patient is definitely less. Like we are seeing only around 5%, maximum 5% of these population who have this underlying health problem, they land up in ICUs or wards. Most of these patients, despite having diabetes, generally have mild illness that are taken care of on OPD basis only. So the severity is definitely less, but still, if they have all these risk factors, we are seeing few cases who land up requiring ventilator assistance also.
This virus, how much time it will take, sir, to this Omicron will goes from everybody? Do you
So
think any
third wave, there was one statistical study by Indian Institute of Science in Bangalore. They said that we will be peaking till the end of March. Like because India is such a wide country with the different states, has its own peak. So for example, in Telangana and Hyderabad right now, we have large number of cases which are coming up. So we will all peak, and finally the peak is expected to reduce by the end of March in India. So probably after that, we will be having less number of cases. This is a prediction. We don't know. Like in between, there should not be new mutations, and there should not be new variants that are coming into the picture. So depending upon the vaccination status, depending upon the incidence of pre-infections and incidence of immunity levels, they are saying that we will probably finish our peak by the end of March, and by the end of March, the cases should start decreasing throughout India.
Okay. Sir, do you think this Omicron will, if any person infected with Omicron, nearly in our records, nearly up to, if 100 members will do Omicron, nearly 70% they are getting positive, sir. Do you think they need compulsory this quarantine, home quarantine for this 70%? That much severity
home quarantine as of now in India is mandatory as per the government guidelines. We need to quarantine if you are detected positive for at least 7 days from the onset of symptoms. That is the government advisory.
Okay.
So for India, yes, we need to quarantine as per the government rules, and we need to quarantine for 7 days if you are infected with COVID.
We have to quarantine up to negative report will come. Otherwise, after 7 days without testing, we can go for duties. We can attend to.
The government is very clear. Government
jobs.
guidelines are very clear. There is no need to retest to show that you are negative. So
Okay.
after 7 days, you can assume that you are not capable of transmitting that infection, and you can go back to your routine. And there is no point in retesting whether the COVID is positive or not, because there are chances of even having a false positive. That means even
Okay.
though you don't have COVID, at the end of 7 days also your report may come positive. So there is no point in testing for COVID at the end of 7 days.
Okay. Sir, one more question, sir. This booster dose is required compulsory for to each and every person. There are so many persons
In
are
India,
taking
we call
booster
it as
dose.
the precautionary dose rather than the
Yeah.
booster dose.
Yeah,
And yes, it is one of the means of reducing your severity of the infection. It doesn't mean that
Okay.
once you get a booster dose, you will not get COVID. You may get COVID, but your severity of the infection will be less. And generally, booster doses are recommended at least 6 to 8 months following your second dose of COVID vaccination. And if you are already infected, you need to wait at least for 3 months before you take your next booster dose. And right now, booster doses are indicated only for people in frontline workers or healthcare workers or people who are aged or with comorbidities. But maybe in future, we may see that even other patients may require booster dose, because the amount of the immune response that you get out of the two vaccines tends to decrease with time. And to reboost this immune system, you need these booster doses.
So coming to booster doses or precautionary doses, first for first dose and second dose, if they will take Covishield, compulsory they have to take Covishield only. Otherwise, they have to skip. They will take Covaxin also. So many
So in
persons
India,
are
we
the
don't.
dilemma.
Yeah. So in these,
About this
this is called as a mix matching strategy. This was done
Okay.
primarily for mRNA virus vaccines that are available in US. So in India, we still do not have any data to say that if you mix match the vaccine, you will have a good response. So yeah, you
Okay.
can take either of the vaccine that is available, and there is no indication that you definitely have to mix match the vaccine. So if you have taken Covishield, you can take Covaxin or Covishield. So there is not much of difference.
Okay. Well, thank you very much, sir, for your valuable time spending.
Yeah, thank
Hello.
you, Ravi. Thank you.
Thank you very much, sir.